If you've been reaching for something at night just to make yourself sleep, Tylenol PM, a sleeping pill, a glass of wine, maybe a pain tablet you had left over from a dental visit, how certain are you that what you're calling sleep is actually safe sleep? Not drowsy, not sedated, not knocked out. I mean truly safe for your brain, your breathing, your heart, and your balance by morning. Because after 60, the margin for error gets smaller than most people realize. And one of the most dangerous mistakes I see seniors make is mistaking sedation for rest. Subscribe now for clear, practical senior health guidance that may protect you or someone you love in the years ahead. Tonight, I want to talk about a habit that looks harmless from the outside and sometimes even feels responsible. You can't sleep, so you do what millions of people do. You take something, maybe over the counter, maybe prescribed years ago, maybe borrowed from an old routine that used to work. And because you close your eyes and drift off, you assume the problem is solved. But sometimes the thing that helps you fall asleep is the very thing making that sleep less safe, less restorative, and in certain situations, dangerously unstable. I want to start with a story because it captures this perfectly. And I need you to listen closely. A man in his early 70s had been struggling with sleep for months. Nothing dramatic, just the kind of tired frustration so many older adults know too well. He would lie down at 10 o'clock, stare at the ceiling, feel his mind racing, get up twice to use the bathroom, then finally reach for what he called his backup plan. Some nights it was a PM pain reliever. Some nights it was a prescription sleep pill. Some nights it was a drink first and the pill second. He figured he was being practical. He wasn't trying to get high. He was trying to get rest. From the family's point of view, he just went to bed and never woke up. No crash, no loud emergency, no obvious final warning. Just a quiet night that turned tragic by morning. And here's the part that should make every senior stop and think. It usually isn't one single dramatic poison that creates these situations. It's the layering, the bedtime pill on top of the evening drink, the pain medicine on top of the anti-anxiety tablet, the loud snoring that nobody took seriously, the untreated sleep apnea, the age-related changes in how the body clears medication, the mistaken belief that if something is sold over the counter, it must be gentle. That combination, that exact pattern, is what I am begging seniors to stop doing after 60. Because this, the dangerous thing in the title, is not merely taking a sleeping pill. It's the habit of forcing sleep without understanding what you are forcing your body through to get there. It's using sedation as a shortcut while ignoring the reason sleep broke down in the first place. It's combining things that slow the brain, relax the airway, dull the reflexes, and linger in an older body longer than expected. It's assuming that if you stayed in bed all night, that means your body got what it needed. And that assumption, more than people realize, is where the danger begins. Let's make one distinction absolutely clear. Sleep and sedation are not the same thing. Real sleep is an organized biological process. Your brain moves through different stages. Your breathing should remain stable. Your body should repair, regulate, consolidate memory, and restore energy. Sedation, on the other hand, is a chemical push toward unconsciousness. It may make you less aware, less reactive, and less likely to wake up. But that does not automatically mean it is improving the quality or safety of your sleep. In fact, in some people, especially older adults with hidden sleep apnea, lung issues, medication interactions, or nighttime instability, sedation can make the night more dangerous precisely because it suppresses the body's ability to respond. And this is where so many seniors get caught off guard. Because the most common sleep aids in America do not look dangerous. They look familiar. Tylenol PM, Advil PM, Benadryl. Nighttime cold medicines. Allergy tablets that happen to make you sleepy. What many people do not realize is that a lot of these products create drowsiness with antihistamines like diphenhydramine or similar ingredients. That drowsy feeling gets interpreted as help. But after 60, these are not small, innocent helpers. They are medications with side effects that older bodies often tolerate poorly, and they can create problems that reach far beyond the bedroom. Here's what makes that especially important. And I want to slow this down. Older adults are more sensitive to medications that affect the brain. They are also more likely to have kidney issues, liver changes, balance problems, enlarged prostate symptoms, constipation, memory concerns, multiple prescriptions, and interrupted breathing during sleep. So the same over-the-counter sleep aid that leaves a 35-year-old groggy for a few hours can leave a 72-year-old foggy into the next afternoon, unsteady in the bathroom at 3 a.m., confused when waking, dried out, constipated, unable to empty the bladder properly, and more likely to fall. That is not a minor inconvenience. That is a genuine safety issue. And then there is the trap that almost nobody talks about, clearly enough, tolerance. A lot of over-the-counter sleep products work less and less well the longer you take them. So people don't just use them temporarily, they begin chasing the effect. One becomes two, or one tablet plus a drink, or one PM product plus a separate prescription, because the over-the-counter one is weak. That is how a person slides from occasional use into a nightly chemical routine without ever making a conscious decision to become dependent on it. They simply become afraid of the night without it. And once fear joins the routine gets harder to question. I want you to picture a very ordinary midnight scene, because this is where real life happens. You wake up to use the bathroom. Your mouth is dry from the medication. Your bladder still feels full, but won't empty well. Your legs feel heavy. Your thinking is slow. You stand too quickly. The room tilts for 2 seconds. You steady yourself on the wall and tell yourself you're fine. That moment right there is one of the most dangerous moments in an older adult's day. Not the highway, not the grocery store parking lot, the bathroom trip after a sedating nighttime medication, because falls do not require drama. They require 2 seconds, a dark hallway, and a brain that is not fully alert. And some of the side effects, people never connect back to the sleep aid at all. Confusion gets blamed on aging. Dry mouth gets blamed on not drinking enough water. Constipation gets blamed on diet. Blurred vision gets blamed on cataracts. Difficulty urinating gets blamed entirely on the prostate. Daytime fog gets blamed on sleeping badly, which becomes almost darkly ironic because the very thing someone is taking to sleep may be the thing making the next day feel mentally dim. If that has ever happened to you, if you've ever felt hungover from something that wasn't alcohol, or weirdly off after taking a nighttime pill, I want you to know that your body may have been trying to tell you something important. Let me ask you something simple, because I really do want people to think honestly about this. Have you ever taken a PM product, or a nighttime allergy pill, or something just to help you drift off, and then noticed you felt strange the next morning? Not sick, exactly. Just slower, off balance, drier, heavier. If so, you are not imagining it, and you are definitely not alone. A lot of seniors have normalized that feeling because nobody ever sat them down and explained what these products are actually doing in an aging body. Now let's move to prescription sleep medications, because this is where the conversation gets even more serious. There are people who genuinely need short-term help for insomnia, and there are situations where a clinician may decide a prescription sleep medicine is appropriate. But the mistake is thinking that prescription means precision and safety in all circumstances. Some of the most commonly used sleep drugs can increase next-day drowsiness, impair judgment, raise fall risk, and in certain cases trigger bizarre nighttime behaviors that people do not even remember. That last part matters more than most seniors realize. There are prescription sleep medications that have been associated with what are called complex sleep behaviors. And the term sounds too gentle for what it can mean in real life. We are talking about people walking, driving, cooking, taking more medication, wandering outdoors, and doing other activities while not fully awake, sometimes with no memory of it the next morning. Think about how frightening that is. Not just being sleepy, not just a little groggy, acting in the world while your brain is only partially online. For a healthy younger adult, that is already serious. For a senior with stairs in the house, loose rugs, a walker nearby, or mild cognitive changes, that becomes a different level of risk entirely. And here's what makes that risk so deceptive. It can happen at regular doses. People often assume dangerous drug reactions only happen when somebody abuses a medication or takes way too much. But sometimes the issue is not overdose in the way people imagine it. Sometimes the issue is sensitivity, interaction, timing, age, hidden sleep apnea, alcohol, or a body that simply does not clear the drug the way it used to. That is why I get so concerned when seniors casually say, "Oh, I only take half," or "I only take it once in a while," or "It's fine because I've taken it before." Those statements sound reassuring, but they don't actually remove the risk. Then we have another group of medications, the anti-anxiety drugs and older sedatives that many people still have in their medicine cabinet: Valium, Xanax, Ativan, similar medications in that family. These can absolutely make people sleepy, and because of that, they sometimes get used as unofficial sleep tools. But older adults often hold on to these medicines longer in the body. The effects can spill into the next day. Balance can suffer, memory can suffer, confusion can creep in. And if these are combined with pain medicine, alcohol, or other sedating pills, the risk does not simply add up. It stacks. That stacking effect is where nights become dangerous. I want to spend a minute on pain medicines, because this is one of the most underestimated hazards in older adults who cannot sleep. If a senior is taking an opioid for back pain, joint pain, surgery recovery, or chronic pain management, the breathing risk at night goes up. And if you add alcohol, benzodiazepines, muscle relaxers, or certain sleep medicines on top of that, the risk increases further. This is not fear-mongering. This is physiology. Opioids can suppress the brain's drive to breathe. Other sedatives can deepen that suppression. A person who already snores heavily, already stops breathing briefly, or already has sleep-disordered breathing is entering the night with far less safety margin than they think. That brings us to one of the biggest silent players in this whole conversation, sleep apnea. I wish more seniors understood how often sleep apnea sits underneath the nightly sleep struggle. A lot of older adults do not realize they have it. They think they are just tired, or just bad sleepers, or just loud snorers, or they blame aging. But sleep apnea means the airway repeatedly narrows or collapses during sleep. Oxygen can drop. The brain keeps having to nudge the body awake to reopen the airway. Sleep becomes fragmented and shallow. Then the next day, the person is exhausted, so what do? They look for something stronger to force sleep the following night. That is how the cycle tightens. And now comes the truly dangerous misunderstanding. Because sedatives and alcohol can make sleep apnea worse. They relax the tissues in the throat. They make it harder for the airway to stay open. They can make breathing pauses longer, deeper, and more severe. So the very senior who says, "I need something to finally stay asleep," may actually be using a substance that reduces the body's ability to protect itself during the exact breathing problem keeping sleep broken in the first place. That is why some people wake up feeling terrible after sleeping all night. They did not get stable, restorative sleep. They got a chemically quieter version of unstable breathing. If you share a bed with someone, or if someone has ever mentioned your sleep to you, pay attention. Loud snoring, gasping, choking sounds, long pauses in breathing, morning headaches, waking with a dry mouth, falling asleep in the chair during the day, nodding off during conversations, memory getting worse, irritability, trouble concentrating. Those are not random inconveniences. Those are clues. And if a senior with those symptoms is also taking nighttime sedatives, drinking in the evening, or using PM products regularly, that is not a routine I would shrug off. That is a conversation I would push to the top of the list. Let's talk about alcohol for a moment. Because a lot of people still believe in the nightcap as if it were a harmless old-fashioned sleep trick. Alcohol can make you feel sleepy, yes. That part is true. But sleepy is not the same thing as well-rested. Alcohol can fragment sleep, worsen snoring, worsen sleep apnea, increase nighttime trips to the bathroom, and leave sleep less restorative overall. On top of that, when alcohol gets combined with sleeping pills, pain medicines, anti-anxiety tablets, or other sedating drugs, the risks rise again. Seniors often tolerate alcohol differently than they did at 40 or 50, and that matters. The body changes, the brain changes, the margin changes, and sometimes, this is the most important point of all, the insomnia is not the primary problem. It is a symptom, a signal. The body is trying to tell you something, and instead of listening, many people smother the signal with sedation. Maybe the real issue is poorly controlled pain. Maybe it is acid reflux waking you up. Maybe it is depression. Maybe it is anxiety after a spouse has died. Maybe it is restless legs. Maybe it is a diuretic taken too late in the day, forcing 3 bathroom trips by midnight. Maybe it is heart failure causing shortness of breath when you lie flat. Maybe it is dementia starting to disrupt sleep-wake rhythms. Maybe it is sleep apnea. Maybe it is a medication side effect. You do not fix those problems by simply being more unconscious. That is why I want seniors to stop asking only one question. What can I take to sleep? And start asking a better question. Why did my sleep change? That one shift can save people months or years of trouble. Think about the timeline. When did the poor sleep begin? What changed around that time? A new medication, a stressful event, increased pain, more nighttime urination, new snoring, weight gain, more napping, more caffeine, more loneliness, less daylight, less activity? The answer is often hiding in plain sight, but it stays hidden when every bad night gets answered with another pill. And I also want to say something that many seniors need to hear plainly. Waking up during the night does not automatically mean you need a sleep medicine. Aging changes sleep patterns. Older adults still need enough sleep, but many do go to bed earlier, wake earlier, and have more brief awakenings. The existence of a nighttime awakening is not itself proof that something strong should be added to the body. What matters is the overall pattern, the daytime consequences, the underlying cause, and whether the solution is making the bigger picture safer or more fragile. A senior can turn a manageable sleep problem into a dangerous medication problem by treating every restless night as an emergency. Here's another question I wish every viewer would answer honestly. And if you're listening with a spouse or parent, answer it out loud. Are you trying to fix your sleep, or are you trying to escape the frustration of being awake? Because those are not the same thing. When people get desperate enough, they stop thinking in terms of sleep quality and start thinking in terms of sedation force. I just need something strong. I need to be knocked out. I don't care what it is. That mindset is understandable, but it is exactly the mindset that leads people into dangerous combinations and routines they would have rejected if they were thinking clearly at 10 o'clock that morning. So what does a safer conversation look like? If you are over 60 and struggling with sleep, it starts with a medication review. Every pill, prescription, over-the-counter, herbal, pain products, allergy tablets, nighttime cold medicine, gummies, everything. Bring the bottles if you have to. Ask, which of these can worsen balance? Which can worsen confusion? Which can dry me out, constipate me, or make me retain urine? Which can worsen breathing at night? Which should never be mixed with alcohol? Which are lingering too long in my system? Which are actually treating the cause of my insomnia? And which are simply sedating me? Those questions change the entire quality of care. The next piece, and this is where good medicine often outperforms quick medicine, is treating insomnia like a pattern rather than a single bad night. Cognitive behavioral therapy for insomnia, often called CBTI, has helped many people without requiring them to build their lives around sedatives. That does not mean it is instant. It does not mean it is trendy fluff. It means learning how sleep pressure, routine, light exposure, worry, bedtime behaviors, napping, and conditioned frustration interact. Many people are shocked to learn that what actually improves sleep long-term is not always more sedation. Sometimes it is restructuring the habits and thought patterns that taught the brain to fear bedtime. And yes, some of the basics matter more than people want them to, even if they sound simple. A consistent wake time. morning light, daytime movement, less napping, especially late in the day, avoiding caffeine too late, avoiding alcohol as a sleep tool, not turning the bedroom into a second living room full of television and scrolling and emotional stimulation, finishing heavy meals earlier, taking certain medications earlier if appropriate, managing pain before it peaks at bedtime, keeping the room dark, cool, and quiet. These sound ordinary because they are ordinary. But ordinary physiology is exactly what sleep depends on. The body loves rhythm more than it loves rescue. Those honestly, you and your clinician will have a far better chance of solving the right problem rather than creating a new one on top of the old one. A lot of seniors tell me, but I've been doing this for years and nothing bad has happened. Why looking backward can be misleading. I've always done this is not a safety certificate. And there is another small but important. Here is the truth I most want seniors to carry out of this conversation. And it may be the most important line in the whole video. The goal is not to be unconscious. The goal is to get safe, restorative sleep in a body that is changing with age. Those are not the same thing. A pill, a drink, or a combination can make the night feel quieter while actually making the body less protected. That is why I get so firm about this. Because people do not usually get hurt by the thing they fear. They get hurt by the thing they underestimate. So when I say, I beg seniors to stop doing this after 60, here's exactly what I mean. Stop casually knocking yourself out at night. Stop mixing sleep aids with alcohol. Stop borrowing old prescriptions as if the body has not changed. Stop assuming over-the-counter means harmless. Stop ignoring loud snoring and daytime exhaustion while covering it with sedatives. Stop treating every bad night like it needs more chemical force. And please, stop suffering in silence with a sleep problem that may have a treatable cause no one has properly evaluated. If you need a closing framework, keep this one. If it sedates you, respect it. If it lingers into the morning, report it. If it changes your behavior at night, stop and call. If it worsens balance, rethink it. If you snore, choke, or gasp, investigate it. If you need it every night, question it. And if you are using one substance to cancel the effects of another, pain, anxiety, loneliness, alcohol, stress, then what you have is not a sleep solution. You have a dangerous pattern that deserves a real plan. You took the time to watch this because something in you knows sleep after 60 should not feel like a gamble. And you're right. It shouldn't. Good sleep is one of the best protections we have for memory, mood, heart health, balance, and quality of life. But the path to better sleep is not always stronger sedation. Sometimes it is a sleep apnea test. Sometimes it is a medication review. Sometimes it is grief support. Sometimes it is adjusting what time you take your water pill. Sometimes it is treating pain differently. Sometimes it is CBTI. Sometimes it is simply finally understanding what that harmless bedtime habit has really been costing you. If this helped you, share it with someone you love who keeps a PM bottle near the bed, takes a nightly sleep pill, or says they need a drink to sleep. They may not realize how much risk can hide inside a routine that feels normal. And if you want, tell me in the comments what you've been using to sleep. Just the category, not your private details, because I read those comments and they help me understand what people are quietly dealing with. And please, if your nights have been ruled by constipation, bloating, or the feeling that your body just is not working the way it used to, watch the next video on your screen, because that silent discomfort is another place seniors ignore warning signs far too long.